One message that I wish I could express to all couples considering a vasectomy reversal is related to expectations. Now, my wife has said that I can sometimes be like a wet blanket and that I can find a way to take the excitement or joy out of any situation. Now, that's definitely true, but too often we hear of people who are 100% sure they're going to achieve a pregnancy and they'll be pregnant in the first month or so, and they've told family and bought clothes and so on. Or we'll get people who are concerned if their sperm counts are not exactly where they want them to be, or if they fluctuate from one test to the next. They may hear of pregnancies and other success stories on Facebook or other social media sites, and often this leads to a significant amount of anxiety for themselves and for others. However, while immediate pregnancies do occur, these are the minority of cases. In this video, we're going to try to review realistic expectations, including sperm versus pregnancy success rates, which findings on a semen analysis are important, the average time to achieve a pregnancy, and comparisons between reversals and in vitro fertilization. Now, it's our hope that this will help provide important information to help in making a decision as to whether or not to pursue a reversal. Most often, success rates, which you'll read about on websites and even scientific publications, will report the chance of return of sperm at some point post-op. And in the estimated success rate which we supply, this is the number that we use as well. Now, we do this because it gives you a chance to compare in an apples-to-apples type way to other practices out there. But really the key question that many patients want to know is, what are our chances of getting pregnant? This is very hard to answer, as there's many things which contribute to a pregnancy, including partner age, time since vasectomy, and many other factors. Overall, when you look at published numbers around the world in the past 10 years, the median percentage reported for pregnancy is 35%. Now, we don't want to make anyone look bad here, so I've removed the names associated with these clinics. But if you look into the most experienced providers with publications in reputable journals and good study methodology, they tend to be in the 20 to 30% range. The higher success rates are typically from studies where they only include people who self-report pregnancies or have high baseline fertility. Now, this obviously inflates the rates, and none of these studies looked at all comers, which would include couples where pregnancy is highly unlikely to occur and thus lower the overall success rate further. So, the key take-home here is that the actual pregnancy rates for couples which are otherwise fertile is probably in the 20 to 30% range at best with traditional techniques. Well, there are several reasons for this. For one, some men will experience an initial return of sperm, but then will have the repair completely rip apart. Others will have sperm for a while, but then eventually the repair scars down or closes at a later time point. Now, this later scarring occurs in about 30 to 40% of cases within the first year, and likely even higher than that as more time passes. Now, this is consistent across the world and across practices. Now, other cases will continue to have sperm, but the numbers are going to be too low to give them a good chance at pregnancy. And then, of course, there are many other fertility factors. For example, female partner age, fertility factors, testicular fluid findings at the time of surgery, the time since vasectomy, smoking, obesity, prior pregnancies, and other things will all impact the numbers. A very common misunderstanding post-reversal is how to interpret sperm numbers. For example, the best published data as of the time of this video shows that if you're above 5 million sperm per milliliter at 6 weeks, you have as good of a chance at achieving a pregnancy compared to people who are above 15 million or even more. Now, we have a very detailed description about this on our website in the post-op section and separate videos on this particular topic. So I'd encourage you to spend some time and visit that area of our website for the most up-to-date and accurate information. People will certainly hear of individuals getting pregnant in the first month or two after reversal. This definitely happens, but the average time to achieve a pregnancy is 12 to 17 months. Now, that means that half of the people who will eventually achieve a pregnancy won't do so until they're about 12 to 17 months out. This is very important to understand because there's often a lot of anxiety among couples if they're not pregnant within the first few months. But getting pregnant that quickly is definitely an unrealistic expectation in the majority of cases. IVF live birth rates per cycle are relatively similar to those which are achieved at a reversal. Specifically, although pregnancies per IVF cycle are in the 60% range for women who are 35 or under, the actual live birth rates are in the 30 to 40% range. This drops rapidly with advancing female partner age and becomes 5% by age 40 and 0% by age 45. So the decision between picking a reversal versus IVF is a complicated one, and the right answer will likely be different for each couple. For those interested, we have a much more detailed set of information about the advantages and disadvantages of each approach on our website. When all things are considered, a vasectomy reversal is probably the best first step to trying to achieve a pregnancy post-vasectomy for most couples. And although we do the highest volume of vasectomy reversals of any practice in the United States, our pregnancy rates are similar to other high-volume surgeons who are able to perform epididymal vasostomy repairs and are helped with the addition of the revas technique. It's therefore important to recognize that even in the best of hands and the best circumstances, pregnancy is not a guaranteed thing and may take several months or years to achieve. And many couples may still need to undergo either a second attempt at a vasectomy reversal or even IVF. But I would strongly caution people to be very wary of chat rooms, Facebook groups, blogs, or even individual surgeons which suggest otherwise, as there's often a significant amount of misinformation, advertising, and salesmanship out there on this topic. Now, particularly if someone's quoting pregnancy rates over 50%, you should be very suspicious. This misinformation can often lead to inappropriate expectations or therapies, bad decisions, wasted money, and unnecessary anxiety. Well, we hope that this has been helpful. I've definitely found that having accurate and complete information is necessary to make any important decision. As always, feel free to reach out anytime if you have any questions, and we'd be happy to help. Thank you.